Good morning and welcome everyone. Thank you so much for joining us for this webinar on What Works, Family Hub's Innovation Fund findings to date. It's brilliant to see so many of you here this morning. I'm Bronya Arnott, Regional Implementation Advisor at the National Centre for Family Hubs. Closed captions will be available during the webinar. Please click on the Closed Captions button to enable these at the bottom of your screen. The chat function is disabled during the webinar. If you have any questions, please submit them via the Q&A function. There is also the option to upvote any popular questions. All presentation slides from today will be available after the event and shared via email. The webinar will be recorded and available on the Anna Freud Centre YouTube channel in the coming weeks. If you have any technical issues, please put these in the Q&A function and a member of the Anna Freud Centre will be able to assist you. Just briefly, for anyone joining us today for the first time, the National Centre for Family Hubs is an online resource hub and learning network which has been funded by the Department for Education and is being led by the Anna Freud Centre, the UK's leading evidence-based charity for children and families' mental health. The National Centre is designed to support the development and implementation of family hubs and to spread best practice across England, taking into account what families tell us they want and need, what providers tell us about good practice, and what we know from evidence about what works. Today's webinar is part of a rolling programme of learning events hosted by the National Centre, and recording and resources from all of our previous events are available on our website. And so today's event will be exploring the interim findings from the Department for Education Family Hubs Evaluation Innovation Fund. Sheffield Hallam and Ecorys partnership were commissioned to deliver a programme of research working with 6 local authorities across England. We also have events scheduled over the next couple of months that you might be interested in. Next month, we have a webinar on using behavioural insights to increase the reach and take-up of Family Hub services, findings and lessons learned. In April, we have our 3rd national conference, our first in-person conference, which will focus on family hubs and integration. You can book your place for these events via our website, and we'll share a link to the booking page in the chat. And so you will see on our website, we have lots of resources available. If we're able to move the next slide on, thank you. And you can also join our Family Hubs in Mind Learning Network to receive our newsletter, where we'll share details of future events and other resources. And you can also contact us directly via our inquiries inbox or our phone line. So, moving to our agenda for today. Understanding what works in terms of family hubs is important to inform development and implementation of family hubs. The evaluations conducted through the Evaluation Innovation Fund aim to explore what works in local areas with different family hub models and at different stages of maturity. This learning event today will share the emerging findings and future plans. We are joined by a brilliant lineup of speakers to explore this topic today. We are going to start with a presentation in a moment from Laurie Day and Valdeep Gill from Ecorys UK. Next, we will be joined by colleagues from Sheffield Hallam University, Professor Sarah Pearson and Professor Mike Caldwell. We have a great panel session for you with colleagues from Doncaster Council, Sefton Council, Families First Leads and Essex Child and Family Wellbeing Service. And then we will have all of our speakers join us for a Q&A session. If you do have any questions or comments, please do pop them in the Q&A function and we will try and bring these into the discussion where possible. Anything we don't get to today, we will collate a list of frequently asked questions, which we will make available on our website. So it's a pleasure now to introduce colleagues from Ecorys UK. Laurie Day is Director at Ecorys with lead responsibility for children, young people and families research. He has over 20 years evaluation experience with an emphasis on family-minded policies and programmes. He is overseeing the Family Hub's evaluations led by Ecorys. And Valdeep Gill is Associate Director at Ecorys UK. Valdeep specialises in children and families policy research and is the project manager for the Ecorys-led evaluation of the Family Hub's Evaluation Innovation Fund. Laurie and Valdeep, a very warm welcome to you today.
That's great. Thank you, Bonya, and good morning, everyone. Valdeep and I are really pleased to be presenting the findings from the interim report from the evaluation today. We've got lots to share, and we've only got 20 minutes to do it, so we'll try to keep things quite focused. I'm going to give you some background to the origins of the evaluation and the approach that we took, and then we'll go through some of the headline findings. And the interim report is also published, so you'll have access to the full findings on the website. Okay, next slide, please. So we started our work in March 2021, and we were one of two separately commissioned partnerships between evaluators and local authorities developing 0 to 19 integrated family support services. I think important to note just from the outset that with the timing, this predated the two major national funding programmes and the development of the model framework. So at the time we were working with local authorities and their partners that had developed their own approach, sort of predating the national agenda to some extent. The other important emphasis is very much a partnership, so it's not the regular approach of coming in to evaluate a funding programme sort of post hoc. From the outset, we were working with our 5 local authorities to really sort of co-produce the evaluation, which is quite an exciting and quite different model to the one that is regularly used. So working with Bristol, Essex, Leeds, Sefton and Suffolk, and we purposefully selected local authorities at different stages in their journey, different needs and characteristics at the local level, so we could really capture that variety. Next slide, please. So the evaluation has 2 strands to it, really. So the first is a programme level. Part of what we're doing is gathering learning and evidence in terms of what works to inform the national evidence base, which is why it's important to have these different models within one evaluation. But at the same time, we are also working hand in hand with 5 local authorities, each of whom has a lead researcher assigned to really get to know the local authority and their partners and how the work is progressing, and to build capacity for evaluation. So across all of our local authority partners, we're carrying out an assessment of effectiveness, outcomes, impact, looking at how we can assess value for money for family hubs, really understanding the added value of a hub approach over other possible alternative models, understanding what works for whom, how and why, amplifying the views of and experiences of children and families through participatory methods, and really with a view to developing transferable toolkits and guidance to share with the National Centre. Next slide, please. So I won't go into too much technical detail here. There's a lot more on this in the reports, but I think the key things really to draw out here, we had a 6-month scoping and development stage, which I think was really important in this context to work quite closely with each of our local authorities to develop an evaluation plan that really sort of wraps around where they're at, the types of outcome measures they're seeking to achieve, and based around a theory of change for each of the local programmes to really give us something to work together on. We then have 5 other work streams that we have packages of work that we're carrying out across the piece. So we're doing qualitative research and surveys with each of our local authorities that we're working with. There's an impact evaluation, which is tailored to the stage of development that they're at, same with economic evaluation. There's also a very active action learning element. So we are bringing evaluators and local authorities together at key points to share learning, insights to practice in terms of what works. And within 2 of the local authorities, we're also carrying out some participatory action research and working with families as part of the process of gathering and reporting on the evidence, with 2 main reporting outputs. Next slide, please. So we have 2 published reports to date from the evaluation. The first one, which is again available on the internet, we can share details later, is provides details of the local plans. So this really gives you a flavour of sort of how we're going about working with partners at the local level to carry out evaluation, which elements we're capturing and which elements local authorities and their partners are capturing. And then we have our first main interim report, which gathers and reports on the evidence that we've collected to date. And it's this that forms the main basis of some of the findings we're going to be sharing today. So on that note, I'm going to hand over to my colleague Valdeep, who's going to go through the key findings to date. Valdeep.
Great, just take myself off mute. Okay, great. I'm going to go through some of the headline findings from the interim report. The report details the findings much more, so you can go there to sort of get more depth on each of the findings. So the findings are from across all 5 local authorities in our evaluation. We consulted with a number of professionals and with families about their view of the Family Hub model, what's working well, areas for consideration, but also service experiences as well. So when our local authorities were developing their hub models, they didn't have the existing DFE guidance to go on. So their starting place was very different to local authorities who are transitioning more recently to Family Hub models. Something that was common across all of the 5 local authorities was that they built up from the existing infrastructure within their local authority, so building on the strengths of current services and provision and programmes as well. So we have a couple of local authorities who built up and integrated with existing health services, a number built up from existing children's centres and services for 0 to 5s, and we also have local authorities who built up from strong targeted supporting families programme provision as well. 3 of our local authorities are a bit more mature. They established their journey to Family Hub models a bit earlier, so Essex, Leeds and Sefton. And a clear message from those 3 local authorities was that the Family Hub model doesn't remain static. You have core, universal and targeted offers, but you need to remain responsive to the needs of families and your community as well. Another clear message from the more mature local authorities was that Family Hubs can't be all things to everyone. So the 0 to 19 up to 25 age range covers potentially a real range of services and offers. But in order to be effective, local authorities need to have a clear vision for the remit of their Family Hub. So what types of services they'll be offering and the priority families they'll be working with. So that's all informed by local needs and making sure they're not replicating services that are already existing in the local authority and working well. It's about adding to that infrastructure. So the next set of findings are around how Family Hubs are working towards creating accessible services for families. So one key activity that all local authorities are working on and investing in is building relationships with partner organisations, so other services within the local authority that are working with families, so voluntary and community sector organisations, GPs and schools. So this is to make sure that all of those services are aware of the Family Hub model, they know what the service offer is, they know how to refer families in appropriately. Local authorities were really clear that this isn't a one-off piece of work. You need to repeat the hub offer across these services to make sure that busy professionals keep the Family Hub model in mind, and also just accounting for the fact that there will be staff turnover in all of these organisations and services as well. And in order to make sure that this work was is central, some of our local authorities had appointed dedicated community outreach workers and navigator staff to make sure that that sort of community outreach work is happening with services and partners. And on balance, some local authorities decided to invest more in this relationship building versus expensive branding exercises, because that was thought to be a more effective ways to reach families earlier and receive appropriate referrals. So most of our local authorities have a universal support offer. This was seen as really important both from staff and families. Families valued having free to access services, but also it's really important to have sort of community spaces where families can come into hubs and be part of community events, for example, or access free play or youth services to create a sense of sort of community space, bring families together, and that Family Hub services then aren't seen as stigmatizing or places that families only go to get help if there's problems. And these sort of like community and universal activities were a way for staff to build relationships with the communities that they're serving and identify potentially other problems that might be going on for the family as well. Most of our local authorities had digital and outreach offers. This was to make sure that they're not relying on families to come to hubs and reaching families in a place in a way that works for them as well. When we were speaking to families, they really valued having the option of virtual meetings to meet with their family support worker, for example, or taking part in online parenting groups, because that helped to work around other commitments and continue to receive the help that they need. But there was a clear ask from families and staff that they really wanted a return to in-person groups, particularly after the pandemic, and to create those opportunities to socialise with others. So all of our family hubs are working across the whole family and across the 0 to 19 age range and up to 25. But there were some barriers in establishing the 0 to 19 service delivery option. One of the barriers is around having, especially for local authorities that built up from their children's centres, they sort of tended to retain an emphasis on the 0 to 5-year-old services, particularly in the first couple of years of transition. Ex-children's centre staff felt more skilled and confident working with 0 to 5s and families with those types of needs, as you might expect. And there were also instances where local authorities family hub models didn't want to replicate other services that were existing within the services within the local authority as well. So, for example, there were already commissioned youth services that family hubs didn't want to replicate. And finally, there was a clear message across local authorities that hubs aren't always appealing or suitable places for adolescents. So that's something that could pose a barrier to working with those older age groups. Staff cited multiple benefits of integrated 0 to 19 hub working. Staff really liked having other specialisms and professionals that they could quickly check in with and consult about particular issues families were facing, or refer families quite easily into working with them. Ex-children's centre staff were something that they really liked about the transition to family hub model working was that they could continue working with families after that age 5 cutoff. So that was a source of job satisfaction for them. And also there were local authorities that had found solutions or presented solutions to supporting that 0 to 19 delivery model. One was ensuring that there were staff with appropriate skill mixes, so making sure that there were also staff who were more confident and familiar working with the 6 to 19 age ranges. So bringing in professionals who had previously worked in early help, youth, or are currently working within the police as well. So strong leadership training and supervision can also support with that, not to getting more familiar and confident working across the 0 to 19 age range. One local authority had an active universal youth offer, and that was led by staff who were really confident and had prior experience of working with adolescent age groups. And finally, there was a suggestion at a more strategic level that potentially there are opportunities to upskill family hub staff in identifying needs and risks for older age groups as well. So potentially training around child criminal exploitation. One potential gap for the family hub model across local authorities was having a strong SEND offer. So making sure that there's appropriate provision for families that have children with special educational needs and disabilities. So this was one area that most local authorities thought that they could strengthen further. Staff really wanted training in SEND awareness for conditions that they commonly encounter, so autism and ADHD, for example. Staff said that a key point at which families really needed support was when they were awaiting an SEND diagnosis or were on an SEND pathway for their child, because that wait list could be quite long, but the family still needed emotional support and practical support, particularly around supporting children's behaviours. And families also were really clear that something that they really wanted from family hubs was specialist SEND groups and activities that was suitable for their children and their families, because that was often provision that was missing in the community. One of the local authorities that we're working with has a very strong SEND offer. So they offer lots of professional support, but also peer support as well. And families really valued having access to both practical and emotional support whilst they're going through that SEND pathway. And they really valued having the opportunity to speak to people who had first-hand experience of caring for a child with SEND as well. So the next set of findings are around how family hubs are working to be better connected and joining up workforces and professionals. So all of our local authorities have multidisciplinary working models. A clear message from all of them was that effective multidisciplinary working takes time. So co-location can really support this, but it's really strengthened through shared activities. So actively different workforces and skills mixes, like sort of doing training together, having team meetings, discussing caseloads. And also this is really strengthened by strong leadership as well. And that opportunity of working together was what broke down barriers between professionals, and also just understanding each other's sort of professional viewpoints and language as well. Co-delivery between different professionals was also seen as an opportunity for more integrated working as well. Barriers to joined up working included things like lack of office spaces for professionals to sit side by side, home working, particularly during the pandemic, but also perceived professional hierarchies within the family hub workforce as well. And now thinking about the workforce sort of partnership working and the workforce outside of the core hub model. So staff like, or professionals like health visitors, social care, schools and GPs, staff from family hubs sort of suggested that sometimes they could lack awareness of what the hub offer is, and then therefore make inappropriate referrals as well. One solution to this is that one of our family hubs was placing hub workforce, so school nurses in this instance. They were working in schools, so that was a really good way of making sure that schools understood what the offer is, and they were identifying needs early and referring appropriately into the family hubs. All local authorities had challenges in measuring the outcomes of their services, both for families but also local authorities as well, at the local authority level as well. So all of our local authorities are collecting lots of data on footfall and who's coming into the hub and pre and post measures of group interventions, but they tended to lack the infrastructure and the capability to then make use of that data for service review and reflection. One exception is one of our local authorities who has a more mature hub model, has an embedded measurement outcomes framework, which they've developed over a number of years. They have a shared case management system, which sort of facilitates data collection, and also, and this is really important, I think, a dedicated data team to process that data and then to provide reports for strategic but also operational reflection on the service model. And now finally, I'll just talk a little bit about relationship-centred practice. All of our local authorities and the staff that we spoke to have a real commitment to working with families in a strengths-based way. One of the challenges for the family hub model is partners, so people that sit outside of the core workforce didn't always work in that way, so then families were receiving an inconsistent service sometimes. We spoke to staff and families about what makes for good working relationships between them and professionals, and as you might expect, the sorts of things that were mentioned were having a consistent key worker, because it takes time to build up a relationship with a professional. Feeling listened to was really important, but also the professional's questioning skills, so appropriately asking and being curious about the family's needs, and feeling like there was the professional was being non-judgmental as well, was really important. Now thinking about common assessments, our more mature local authorities had developed guidance and training over time to support all of their staff to assess families' needs in a consistent way, considering the whole family, and then prioritising action plans around this. Staff are really clear that sometimes the family would be referred in for one single issue, but through a skilled conversation, actually, you can uncover multiple challenges that the family is facing. So something that really underpins you don't just need to have a common assessment framework, you also need staff who feel trained and supported to use their professional judgment. We spoke to families about what sorts of supports that they want to access, and a clear message from families is that they don't always want or feel they need a structured formal intervention. Sometimes all they want is to talk to another professional, another adult, to discuss the issue that they're experiencing, so they feel less isolated with it. They receive some reassurance on the right action to take, and it prevents the issue from escalating. And families who had had a positive experience of working with the Family Hub had real concerns about that support coming to an end. They were worried about then feeling isolated or problems reoccurring and then not being able to access support again in the future easily. One barrier to joined up working is staff shortages within Family Hubs. So this is something that all local authorities were sort of grappling with. For local authorities that were new in their transition to Family Hub models, it sort of prevented that transition process and slowed it down. And at an operational level, staff said that they had high caseloads and it was frustrating that they couldn't work with families in a more intensive way because of that. And now I'll hand over to Laurie again.
That's great. Thanks, Valdeep. I'm just going to very quickly sum up some of the key messages, aware that time's ticking on a bit, so I don't want to encroach on the next session. So we document this in full within the report. I think there were some really strong themes that came through collectively across the 5 areas. So it's clear that there was a lot of consensus about what local authorities and partners were trying to do with Family Hubs. So really this vision for 0 to 19 integrated family services, within which hubs are these anchor points, but also it's a sort of much wider transformation program than that. The pathway to actually getting there, so we found that hugely different in terms of the starting points from for different local areas, and also this influence in terms of whether there was a relative emphasis on perhaps starting from Sure Start and building upwards in terms of the age range, or in one of the cases, taking the supporting families model and looking at how that slightly more targeted approach can be extended sort of downwards to the younger age groups. Really strong message about the need to allow time, that systems change, behaviour change is a complex and an ongoing business, so really to be in for the long haul. And then also around the ingredients for a healthy and resilient system to go around Family Hubs. So really important to have this dedicated leadership. So what does this leadership for 0 to 19 integrated family services look like to really sort of bring these components together? As Valdeep was saying, this critical mass of awareness and engagement. So there has to be a no wrong door approach. That really means that everybody has to be buying in. These messages have to be repeated in terms of what Family Hubs are and who they're for. The importance of data and evidence and how that's utilised. And that's something we've been really working through and exploring with local authorities, and getting the most out of existing resources. So really making sure that alongside statutory services, there are these strong links into community networks, and service pathways are very clearly mapped out, bridging universal and targeted services. So I think I'll stop there. We also have some recommendations within the report, which are available, and we'll share the link so that you have full access to those. But thank you very much for listening to us this morning.
Thank you both so much for that really interesting presentation. And I'm now going to welcome colleagues from Sheffield Hallam University. It's a pleasure to introduce Sarah Pearson, Professor of Social Research at the Centre for Regional Economic and Social Research. And Sarah is also Director of the Social and Economic Research Institute at Sheffield Hallam. Sarah has led major evaluations of public policy across a range of agendas, and her research focuses particularly on neighbourhood and community-based approaches to improving outcomes for disadvantaged areas. And also Professor Mike Caldwell, Associate Dean for Research in Arts and Social Sciences at Sheffield Hallam, leading the current deep dive evaluation of the Doncaster Family Hub model. Mike's research interests focus on education policy, professional development, learning and careers, and research use in educational settings. So Sarah and Mike, a very warm welcome to you both, and take it away.
Thanks very much, Bronya. So I'm going to kick off and then hand over to Sarah in a bit. So the evaluation was commissioned in the same way and at the same time as the Ecorys evaluation that Laurie and Valdeep have just been talking about. So the comments that Laurie made around the structure and the timing in relation to how and when the model was developed is the same in Doncaster. So this is going back some time prior to the more recent guidance, and the focus was similar as well. But obviously we were able to work with Doncaster in quite a detailed way, which is what we'll focus on today. Okay, so I'm going to start off by talking a bit about the hubs themselves and the evaluation, and then I'm going to hand over to Sarah. Sarah will talk you through the key findings from the report, which is also available in the same way as Laurie discussed earlier on the DFE website. Through the organisation and management elements and talking about reach and engagement, I'll pick up a little bit on outcomes for families as well, and then finish off. So the aims, again, looking at the service implementation and performance, which is the main focus today. The next report, the final report, which will be published in the spring, will look at outcomes and impacts and value for money of the Doncaster Council model. We've been working very closely with Doncaster, as we'll continue to talk about, and we're delighted to have Alison here, who will be part of the panel later on from Doncaster. So the Doncaster model is, it's crucial to note that it's a locality-based model. So there are 4 localities within Doncaster, and within each of those localities, there are 3 permanent hubs, and then other shared spaces that are used as well, which Sarah will talk a little bit about. So the permanent hub spaces form part of this locality, and that is part of a wider organisational structure within Doncaster. Doncaster itself is a large area, over 300,000 residents, and about a third of them in the city, in the centre there. Varied demographically, of course, with some areas of great need within that. The model at Doncaster, this is a nice representation, a diagram that is used in the city. So the umbrella metaphor covering a whole range of different services, some core services focused on support for young families in particular, and working with other services, particularly we'll talk about today health and voluntary sector services, supporting right the way from pre-birth to 18 with a focus on younger families at the core, but covering all of that ground as noted there. So we'll just look at the research questions in a little bit more detail. We've got 4, as I mentioned earlier, value for money and outcomes will come next. Here we're going to talk about the model for implementation that I've just outlined there, where we're thinking about the locality model. And this is from the perspective of service users and those involved in delivery. We'll be able to say a little bit about the outcomes, in particular in relation to the perspectives of some of the service users and from the delivery agencies as well. Very briefly, the timeline here, which I've just alluded to. So we're in the midst at the moment of data gathering that we'll bring into the final report, which is something to look out for later in the spring. And that will be the same for Ecorys as well. The data we're using is described here. So a set of interviews with key leaders and stakeholders. The bulk and the large focus of what Sarah will talk about in a moment is based on 12 hub-focused case studies from across the 4 locality areas. And each of those, we interviewed a number of different people. We went to see what was going on, and we spoke with, in some cases where we could, with parents and carers, and used some of the administrative data as well, which we've also focused on. I'll talk a little bit about some of the data coming from those latter 2 points, the survey from Doncaster itself and the user survey as well. Actually, some of that will form part of Sarah's presentation as well. One thing I just wanted to mention, I talked about Alison earlier. We've been working, the model we've got is to work very closely in just the same way as Laurie described earlier with Doncaster, and Alison's been crucial in that. She's been embedded within is a member of Doncaster staff, but also is embedded within our evaluation, and is really crucial in enabling that to work from a implementation and performance perspective. So that's a little bit for the background of that, and I'm going to hand over now to Sarah, who's going to start to talk you through the next stages. I think yeah, it'll take a little bit of time to hand over the screen for Sarah to be able to move things on. Over to you, Sarah.
Yes, thank you. I'm going to talk a little bit, as Mike said, about the interim findings, particularly around the performance, implementation and performance of the family hubs in Doncaster, and that's around 3 core themes. We looked at the organisation and management of family hubs. We looked at what's working well in terms of reaching and engaging families in Doncaster, and we also looked at some of the mechanisms for service planning and review and what was working there. Okay, so in terms of the organisation and management of family hubs in Doncaster, I think Mike has already alluded to the importance of acknowledging that the transformation journey in Doncaster has been quite a long one. They've been on this journey for around 7 or 8 years now, and the approach in Doncaster emerged initially as a kind of a service response to thinking about the transition from children's centres. And actually, as Ecorys colleagues also acknowledge the importance of leadership in terms of commitment to the family hubs approach, and in terms of the integrated service offer to children and families in Doncaster has been a really critical factor in that journey. But in terms of the interim findings, perhaps because of that sort of the length of that journey, actually things are fairly well established in Doncaster now. So the governance, leadership, management of family hubs in Doncaster is established and working very well. And we identified, I think, kind of 3 key things that were particularly important in relation to that. So Mike has already alluded to the organisation of family hubs around localities. So a very kind of explicit approach to area-based working within Doncaster, which acts as a key facilitator for service integration and for collaboration and partnership working between local authority services, but also engagement with health services and with voluntary and community sector services around that kind of locality-based model. And then there's also a strong integrated service offer, focusing particularly, as Mike said, on families with younger children, but also signposting advice and offering a range of services for older age groups. So through young carers, things like holiday support, things like engagement with youth clubs and provision for young people. And so a really strong core offer in Doncaster, but also I think critically, a wider offer which can be tailored and adapted according to local need, and specifically responding to the needs of local communities. And as Mike explained, Doncaster is a very diverse local authority area. It's quite dispersed in terms of some of the communities. There are some rural communities as well as some urban communities within the borough, and quite a diverse population within that. And it's crucial that the family hubs are enabled to respond to the specific needs of those communities. In terms of learning in relation to the organisation and management of family hubs, there are also a couple of things that we picked up on. Relationships with partner organisations could be a little bit more difficult, perhaps. Partnership working could be less secure when those partner organisations experience staff shortages. That's particularly a challenge, I think, within the voluntary and community sector, but also emerge for relationships with health service organisations as well. And although that there was a really strong commitment to data and evidence-informed services within Doncaster, again, there were some challenges, which I think colleagues in Ecorys also picked up on, around data sharing, consistency across organisations, and having kind of smooth and effective mechanisms which enabled all partners to utilise that data efficiently. Okay, next slide, please. I don't seem to be able to move these on. Thank you. So moving on now to think about reach and engagement. 3 mechanisms, I think, for engaging families proved particularly important in Doncaster, and we highlighted these in the evaluation findings. That's around the operation and ethos of the family hubs and the buildings and the teams, partnership and collaboration, and targeting of families in need. In terms of the first of those, just moving on to the next slide, please. What came through is really important was the very strong relational approach to family hubs in Doncaster, and a really strong emphasis on an open door culture and family hubs being an enabler of access to a whole range of services for families in the area, and the importance of families feeling welcome in family hubs and able to effectively talk to anybody about any of the concerns that they were facing. And some nice quotes there from parents that we spoke to about the importance for them of the family hubs as a safe space in which they could contact services, but also connect with their peers as well and make connections with other families in the community. Moving on, please. Working in partnership, as we identified, is a really important mechanism for helping families to engage with family hubs in Doncaster. And there are a couple of ways in which that works. The first that we identified was around multi-agency team working. So the integration of family hubs as buildings, but also in terms of family hub staff teams within local mechanisms for place-based working. And those had remits that went beyond those of the family hubs, but actually were really important enablers of early access and early intervention. And we highlight a couple of those there, which the Local Solutions Group, which is a mechanism for enabling the family hubs and other services to respond to families in acute need and possibly families in crisis, and then the Stronger Communities teams and the importance of family hubs being integrated into those Stronger Communities teams as well. Moving on, please. We also picked up on the importance of relationships with wider services as a key mechanism for engaging families through that wider service offer. And that's particularly in relation to relationships with third sector organisations. So we've highlighted counselling support, parenting and family support, and adult and family community learning services as kind of key services which were provided through the family hubs buildings, but perhaps had a slightly different audience in terms of reach and engagement, which enabled the connection of families to family hub services. But again, there were some challenges in relation to that, particularly when third sector services were subject to difficulties around cuts in resourcing. Moving on to the next slide, please. I just want to pick up on here around the potential role of midwifery services, and there's some data here that we collected on instances of engagement from families with particular services delivered through the family hubs buildings over a 12-month period. We need to treat this with a little bit of caution, because actually what this data shows us is instances of connections with services, and there are a range of services presented here which have different frequencies in terms of delivery and also are targeted at different groups of families. But I think what comes through very clearly here is the frequency of engagement of families with midwifery services, and the engagement with that kind of universal and statutory provision where midwifery services are co-located with family hubs has been a really important enabler for introducing families to family hub services. And I think that might be something that Alison will pick up on in a little bit more detail in the panel session. But if we can move on to the next slide, please. What we did see was that family hubs had more engagement with parents who were reached through midwifery appointments when midwives were based at the hubs, and midwives were able then to signpost the families that they were working with to other family hub services. It introduced a degree of familiarity with the family hub buildings, and that was a really important mechanism for introducing families to the other things that family hubs could support them with. Moving on. Okay, we also picked up on the use of local area data, and I think this was particularly important. Local knowledge, local data was particularly important in targeting families in need, and then particularly areas perhaps where there were higher levels of deprivation, more families in need, and where they potentially weren't accessing family hub services to quite the same extent. And there's some detail there on the things that family hub staff did to try and encourage engagement with those areas. So a really kind of strong emphasis on community outreach and engagement, going into spots, leaflet dropping, engaging with communities and making themselves visible, and so on. Moving on, please. Okay, and finally, looking at service planning and review, we identified 3 key mechanisms which inform development of family hub services, and the details of those are outlined in the interim report. but we focused in particularly on parental voice and service user feedback, because that came through as something that was really core to the Family Hubs model in Doncaster, and really important not only to Family Hub staff, but also to parents and families and who were using Family Hub services. And I think, moving on please, just one final slide, which says that parent service user voice is central to assessment of needs and service development in Doncaster. There were a range of mechanisms through which service user voice was represented, through session feedback, through evaluation, and critically social media engagement, which was something that was developed particularly in the Family Hubs in Doncaster as a response to the COVID-19 pandemic, but had also proved to be really important and really useful in terms of ongoing engagement. And I think that emphasis on parental voice has been a key driver of trust in Family Hubs, and actually contributes really strongly to that open door and relational ethos that we highlighted earlier. Okay, I'm going to hand back to Mike now, who I think is going to talk about service user outcomes.
Thanks very much, Sarah. So I'm just going to move on, if I can, to the next slide here. So we conducted a first survey where we developed a tool to gather data on parents and carers experiences and perceived outcomes, as well as the perceived outcomes, the experienced outcomes for them and for children. I should say, as you can see, this was a developmental part of the program, so we had a low response rate. We could see this perhaps as a pilot exercise, and we'll be repeating that in the current part of the program, but it's also a tool which we'll be leaving with Doncaster and can be used by them, and also will be open to other authorities as well, potentially to use or to take on and make use of in their own practice as well. And here we can see some experienced outcomes, positive outcomes from parents, talking about the effects from these relatively small number of responses of the services that Sarah just described, in terms of parental confidence and support, and potentially effects on their own health. Seeing similar changes in relation to confidence for the children, and feeling able to better support their children as well. So generally speaking, very positive. And that correlated with some of the outcomes from Doncaster's own user satisfaction survey, where respondents could talk about ability to access services, and those kinds of connections and understanding their children's needs, which link with the findings that we found from the outcomes survey that we developed. So although the numbers from the Sheffield Hallam survey were relatively small, they correlated well with the user satisfaction survey, and we'll be able to test them out as we gather more detailed impact survey. But I think generally speaking, these provide a picture of positive outcomes from the Doncaster model. So I'll just finish off in brief, with really just reiterating some of the key points that I think we've made. And you'll have recognised Sarah talking a lot about the locality-based model, the relationship between the core and the wider services, particularly voluntary and community sector services and health services, especially midwifery, has been really crucial parts of the Doncaster model. A focus on data gathering and data-led working, which is more detailed in the report rather than in our session so far, was important. But I think drawing on that, we want to emphasise that, as Sarah said, the parent and carer voice, which is a crucial part of the Doncaster model as well. We have identified a few challenges which will be recognisable to all of you, I'm sure, on the call. Resourcing issues, integration in various ways between different services, particularly around data, where there are always issues around integrating data sources, and wide geographical area, meaning that matching need to geography was a crucial element of that. The time at which we were gathering data, challenges such as COVID-19 were still very present, and the cost of living crisis obviously is still with us and growing in many ways. And finally, going back to those self-reported survey data, where we can see some evidence of positive outcomes, which we'll test out as things go on. So that's the end of our presentation. So thank you for listening, and I'll hand back, I think, to Bronya.
So I think that leads us on nicely now. Next, we're going to explore the experiences of some of the areas who've been involved in the evaluation. So welcome to all of our local authority colleague panel members who are joining us. We have Alison Fleetwood from Doncaster Council, Early Years Partnership Manager, Magella Maguire, who is Locality Manager for Early Help at Sefton Council, Lindsay Mortimer, Service Delivery Manager, Families First Leeds, and Lisa Farrell, who is Head of Services at Essex Child and Family Wellbeing Service. Welcome to you all. Good to see you all today. So I thought maybe first, if I could come to you, Alison, could you tell us a bit about your role in Doncaster and a bit about the Doncaster Family Hub model, building on what we've already heard?
Yeah, so good morning, everybody. Thank you for having me today. So I'm a Family Hub Service Manager at Doncaster Local Authority. We were asked to think about some key pieces of learning and key messages, and I felt like the learning and the messages were kind of entwined into one. But one of the key things that I feel was really, really important is our localities model, which I know Mike has explained a little bit to you today. So Doncaster is very, very varied and very vast and very strange in the sense of that a lot of our communities don't actually consider themselves to live in Doncaster. They consider themselves to live in a certain little pocket of community. So we found that anything that we delivered on a borough-wide basis was never going to be successful. So we've had to adopt a localities model and a localities approach to make sure that we are getting to all of those families as early as we possibly can. And that's been a really huge strength because the localities model is embedded across all of our kind of intervention and prevention services, our police services, our health services. So all of us are aligned, all of us are working in the same way. And we've also got an alignment across our kind of frontline operational services coming together at a locality level, but we also have our strategic officers coming together at a locality level as well, so that those key messages, key themes that we're addressing and identifying can kind of be escalated up and back down to whoever needs to know that. And that's a real strength across our kind of family hub model and making sure that we're getting it right for our families. Another key thing for us, again, as mentioned by Sarah and Mike, is we wouldn't be where we are today if we didn't have the strong partnerships that we've got with our health services, and that we, you know, that delivery from within our buildings with midwifery. There are some pockets of that where some of our families might need to go to the hospitals for their appointments rather than seeing those community midwives, those sorts of things. And you can see a real difference in engagement from those families who do not come into that building for that appointment. And one of the key things I think that I always say that I think is really important is that families don't kind of engage with services. Families engage with people. They make relationships with people. And as much as you can ask your partners to promote what you do as a family hub service, a family is less likely to engage in that. But what they will do is meet Jane round the corner in the local family hub, who's really friendly, who offered her a cup of tea and was able to give us some really good advice about how to get baby to latch on a little bit better. So it really is that kind of real groundbreaking beginning point of establishing those relationships, that sense of trust, that sense of belonging within the family hub building, so that then as their kind of pathway develops and grows, it's already become a bit of a safe space for them in their community, and they know that they can come back at that later date. Part for us, I would say our key learning is that if you haven't got strategic buy-in, you're not going to get anywhere. So it really does need to come right from the top, really valuing everything that family hubs can do, and also valuing what an impact that kind of real universal low-level targeted early help can have on everything else within the system, and recognising the value of that and where that sits within all of your services. We've also got really strong buy-in and really strong engagement from our kind of counsellor who's the portfolio holder for children and young people. So she's always banging the drum and always talking about kind of the wonderful work that happens, a regular visitor across all of our hubs, making sure she's got a real keen eye on everything that's happening and how we are making that difference. One thing that we fail, if we could kind of turn the clock back and do things differently. So as mentioned by some of the other presenters, we were one of those areas that kind of developed the old Sure Start Children's Centre model into a family hub model. What we did at the time is it was done very much as an internal service review. So it was very much, this is our service, what do we need to do about it? How do we make those changes? And we then got partners on board as that developed and grew. I would say if we could go back, what we would say is get those co-production models embedded from the outset, really look at how you can commission things together, how you can explore how joined up working can really make a difference for families. It's much, much easier than having to kind of then go back and be less about, well, we're not just a building for you to use as a space. Basically, let's see how we can embed our kind of strategies, our policies and our pathways together and make sure that there's that seamless provision for families.
That's brilliant. Thanks so much, Alison. Majella, I was wondering if I could come to you next. Could you tell us a bit about what your key insights have been with sort of Sefton working with the sort of family hubs evaluation, one or two sort of key takeaways maybe for local areas who are sort of at early stages of family hub development?
Okay, thanks, Bronya. My name's Majella Maguire. I'm a locality manager for early help in Sefton. For those of you who might not know, because Sefton's not one of the more little known places, but it's just above the north of Liverpool city centre along the coastline. It's got very sort of mixed areas of deprivation and affluence, from the sublime to the very, very, very sort of more poor wards within the top 10% in the country. We very much built our family hubs. They're called family wellbeing centres at the moment, and we built them on existing children's centres and family centres. We also worked on the model of integrating our health and also on the Supporting Families programme. So when we were asked to think about what were our key pieces of learning from the research, the main one that jumped out for us within Sefton is our partnership work. It's already been mentioned, partnerships, relationships are key. That whole sort of networking that you can do when you're bringing all the right people together. And key for us is we have an early help partnership board, which is strategically chaired by a health lead rather than a local authority lead. Around the table, we have, it's up to 45 partners around the table. We have children's social care, 0 to 19 health. We have our main children's hospital, Alder Hey. We have commission services around domestic abuse. We have our midwifery partners. We have the PCN, we have police. And that's an ever-growing group, really. And I think key to that is those partners meeting. One example of a spin-off is for a number of years now in Sefton, we haven't received birth data, so we don't have that information on when a baby is born. And I noticed that Sarah in her last presentation said that something around we don't always know when a baby's born. And we are working currently with our midwifery partners at our 2 hospitals to come up with an information sharing agreement. And it's the first progress we've had on that in I'd say well over sort of 7 years. So fingers crossed we get there with that data sharing agreement. And the other thing that is a key piece of learning for ourselves is around joint training. So we've very much focused, since we restructured in 2018, we've really tried to work across the whole workforce around trauma-informed practice. So we've had a variety of different forms of training that we've invited all partners, like I mentioned, those partners around the Early Help Partnership Board. So we've had community resilience and secondary trauma training. We've had adverse childhood experiences training, reducing parental conflict, ghosts in the nursery training, conversations for change. So that we're trying to get that message out across the whole workforce, that we're very much working from a wealth model rather than a deficit, and building families' resilience in that way, and everyone having an understanding of what's gone on before and why families are at the stage they're at. When thinking of key messages to other local authorities, the main ones that jumped out for us was around co-location, because that's something, if it was starting all over again, that's something I would try and be mindful of, making space for, making adaptations for. We've been really fortunate and we've been able to co-locate within our service on a pilot within the last 12 months, our new parent infant mental health service, which is called BABS, Building Attachment and Bonds. And it works so beautifully that within our 3 localities, they have a space in a hub in each area. They have conversations with staff. Staff are learning from them, they're learning from our staff. And then a spin-off from that is co-delivery. So they also co-deliver different programs from within that. So maybe not at your high end of your psychotherapeutic interventions, but they might be delivering a lower level, getting to know your baby, and it might be one of our psychology experts, but it might be with a family hub worker. So again, that's working really well. Integrating and co-delivery around, say, riding the rapids, around work with parents if their children have autism or have a disability. Again, working with our partners within the hospitals and within the CAMS service, and co-delivering with workers from our family hubs. So that's been a real critical element for us. And then finally, it was just to say that if people haven't already done it, to have a look at the family hubs and Start for Life service expectations, of which there's 24. And very much we've pulled that out as soon as it was live, and we've been looking at those 24 areas, and we've been looking at them with our Early Help Partnership Board and asking people to contribute, so that we can look at first what is the minimum, and then we can look at go further. So in summary, just that family hubs is everyone's business for us in Sefton. Thank you.
Brilliant. Thanks so much, Magella. It was interesting to hear you talking about sort of co-delivery as well as co-location. So that was something that would be interesting to pick up later, maybe. So Lindsay, maybe we can come to you next. Please, could you tell us a bit about your role in Leeds and what the model is there, and give us sort of 1 or 2 central insights from the evaluation?
Yeah, thanks, Bronya. Morning, everybody. So my name's Lindsay Mortimer, and I'm one of the service delivery managers within Children's Services in Leeds. So I lead on the Families First programme here, or Supporting Families as it's known nationally. And within that falls our Early Help Hubs, which is quite a different model for anybody who might have read the evaluation. It is a slightly different model to other family and community hub models. We have 3 Early Help Hubs across the city, so in the west, the south and the east, and those hubs are multidisciplinary in terms of how they function and in their delivery. I would absolutely agree with what everybody has said, and I really don't want to repeat that. But in relation to Alison's point, which was around leadership and having strategic buy-in, that is absolutely critical in my opinion. I think having the buy-in and the understanding and a really strong belief from partners and from our lead members and from our senior leadership team really drives the developments. And that's about investment, it's about resourcing, and it is really about having a strong belief that early help will prevent the unnecessary escalation for families to statutory services. And I think we're quite fortunate to have that certainly in Leeds. I think one of the other key pieces of learning is around the importance of working in an integrated way. And I would say that that is very different from working in a coordinated way. And there are some real differences there. And I think whilst nobody would argue about the importance and the benefits of working in an integrated way, it's quite complex work. It takes a lot of time, a lot of patience, and a lot of understanding to bring people together from different disciplines who ultimately all have the same aims and objectives, but often see things from very different perspectives. And I think if I had one piece of advice around achieving that real integrated way of working, it would be about allowing people to slow down, really investing in the workforce development aspects of those integrated teams, having patience and really sitting back and just slowing down thinking so that people can come together and ultimately can be aligned in terms of how they're delivering their offer to families and to the wider partnership. I think in terms of messages, we talk about the developments around family and community hubs, and we almost see them as neatly packaged services. And I think we have to be kind to ourselves, because the developments across all of our local authorities that are here today, we've been working at this for a number of years, and obviously we're all at different parts of the journey. But I think it's really important to see it as building blocks. And whilst there is, you know, a real drive nationally to achieve family and community hubs, it does take time. And I think it's important to almost see developments as incremental, as opposed to, you know, waking up one day and all of a sudden having family and community hubs, and really drawing on the support and advice and the experiences of other local authorities, and going out and seeing what other people are doing. The other key message, because family and community hubs, I think, evolve and develop, and they change in their nature, and they can look different depending on whereabouts you are in a city. I think it's really important that those hubs are tailored with that locality approach to meeting the needs of communities, and to ensure that there is that engagement from the key stakeholders, which are our children and families themselves. I think that brings complexity, because some people could say, well, that leads to inconsistency across the city. So I think one of the really important things is that throughout the journey and throughout your delivery of family and community hubs, you continue to revisit all the time the main aims, you know, the baseline in terms of the main, the non-negotiables, really, the things that have to happen in each of those hubs, but that you continue to deliver and talk about and celebrate those messages, so that people always know what the hubs will be delivering, and really what the purpose of it is. Thank you.
Thanks so much, Lindsay. It was really interesting to hear you talk about the difference between sort of integrated working and more sort of coordinated working. So that's fantastic, thank you. And finally, Lisa, can we come to you? Can you tell us a bit about your role and the Essex Family Hub model, and also some key insights and learnings that you've taken away?
Yeah, of course. Thank you very much. So I'm Lisa Farrell. I'm the Head of Service for the Essex Child and Family Wellbeing Service in West Essex, and also the Strategic Lead for Essex Family Hub. So our model is quite different, in that we're commissioned out to a provider by Essex County Council and Hertfordshire and West Essex ICB. We're a model that, as mentioned earlier, has been in place since 2017, and is an integrated model of 0 to 19 public health, children's centres, which are now known as family hubs, and also children's community specialist health services within West Essex as well. So as people have mentioned, and as Lindsay just said, I don't want to necessarily repeat things that have already been said, because I think there's most definitely shared learning from us all that's been across, in terms of the importance of partnerships, relationships, and most importantly, that strategic buy-in that's also been mentioned. So our model is slightly different, in that we moved away from commissioning in a way of key performance indicators that were very much managed on activity levels, and moved to an outcomes framework of commissioning, which has really supported us in moving to a more integrated model. And I think that's a real key part, I think, of learning, and a message that I would share for people who are on this journey, is that looking in a term of outcomes models you can then create a vision within your strategic and your system partners to be able to identify where people play a role within the system and have kind of those common themes and areas that create those partnerships. Because as people have said, you know, the relationships and partnerships, everyone has a clear aim and value around improving children and young people's lives. However, the method and ways of delivery can be very varied, and in terms of prioritisation of where resource is focused, by looking at things in a more of an outcomes perspective, that has allowed us to form ways of relationships that potentially wouldn't have been created previously, that's integrated the workforce and the wider system better. There was a clear feedback through ours that families had spoken about the value of universal services and their element of value in peer support, but interestingly, both from a staff and workforce perspective as well as the public, there was also more of a focus around there being key things around targeted provision for peer support. So where there's roles around infant feeding, families who are experiencing SEND, rather than those kind of more typical having a place to come to and meet other people. That was valued, but we definitely saw there being a more value with a targeted approach with some elements of peer support. And then I think again, going back to the point around integration, our biggest learning has also been that integration needs to go beyond co-location. So where you have potentially got multidisciplinary teams or opportunities to integrate by that model, it's about how those relationships are there for information sharing purposes, data, and being able to demonstrate the impact of that. So one of our benefits as part of our service is that we work from an integrated health system. So any person working with a family is able to see that journey of a family, to really truly embed that vision of families only having to tell their story once. And that has really supported that integration that goes beyond the reliance of physical communication and sharing that messages through people talking, which we all aspire to do, but with our capacity is often challenging. So identifying ways that can support integration that isn't just reliant on relationships, I think is also a really key part to consider. So yeah, thank you.
That's brilliant. Thank you so much, Lisa. Interesting to hear about your outcomes framework approach. So now I'd like to invite all of our speakers back for our Q&A section, and there's lots of questions coming in the Q&A function. So let's take a look at them now. I think there's a really popular question about safeguarding, so maybe we could take that one first. Safeguarding is highlighted as one of the primary areas for family hubs. How are family hubs ensuring that multi-agency safeguarding is operating at a high quality? And has the evaluation probed how this is being delivered and how it's being monitored? Alison, I wondered if I sort of could come to you first on this.
Yeah, so I think for us in Doncaster, this definitely comes back to what we were saying about having those really strong structures in place. So everything that we do all operates under our what we call our early help steering group, and that's our high level strategic board. And within that, that also links directly into our safeguarding partnership board. So as part of that model, all of our systems, training, policies, procedures, expectations are all directly aligned, regardless of what service that you are working with. So we have a really robust kind of escalation, de-escalation, line management, supervision, training, all of that is all exactly the same, regardless of whether you work in our kind of really acute tier early help support service or whether you are at that real grassroots foundation level of support for families.
That's brilliant. Thank you, Alison. I didn't know if any of the evaluators want to come in and talk about how much the evaluation sort of probed into this.
I can talk a little bit about that. So, so safeguarding isn't one of our specific research questions, but it has come out in discussions with staff. One, that there's been huge safeguarding issues and caseloads following COVID. So then there's a higher caseload for staff in terms of safeguarding, which can be burdensome. for staff to manage. In one of the local authorities that we're working with, they have a dedicated safeguarding team. So staff who had transitioned previously from working in children's centres to now working in the family hub model had access to sort of a dedicated safeguarding support line, which they really valued and saw as a real benefit and difference to working in children's centres, to troubleshoot and understand what the best next steps were as well. So it's sort of come out a little bit, but it's not one of our dedicated research questions.
I think just to add to that, also, I think there was some interesting findings coming through in terms of the evaluation around the relationship with schools and school clusters, and actually engagement in meetings around safeguarding was a potentially effective way to sort of plug the hubs into the safeguarding agenda within schools, but at the same time that can be quite challenging in terms of how those relationships are set up and managed. That seemed to be coming through quite strongly at the interim stage as well.
That's great, thank you all for that. There's also a popular question around how the local authorities work with the voluntary community sector, and whether there's any learning about how family hubs can do that well. Are voluntary and community sector organisations being commissioned to deliver services through family hubs? Perhaps Lindsay, we could go to you on this one.
Yeah, sure. So within our early help hubs in Leeds, we commission voluntary organisations which has enabled us to have some coordinators, some specialist coordinators in our hubs. So we commission services from domestic violence services, from mental health services, and also from substance use services. And those arrangements have worked extremely well. What I would say is, again, that kind of integration and bringing people together from different organisations, and that also includes the police as well, has been fascinating. But we've had to work really hard at that kind of multidisciplinary approach. We obviously link in really well with our colleagues within our commissioning teams. We have regular partnership meetings. We have matrix management arrangements in place. What's really interesting is the different perspectives. It's the many eyes on a problem or a situation, and that's really where the added value is. And you know, happy to kind of have any conversations outside of this in terms of how our approach has worked. Certainly in terms of our arrangements with the domestic violence and abuse service, and also with mental health, have been incredibly successful. I think in terms of substance use, discussions and kind of approaches around substance use are not as progressed, I would say, in terms of how people talk about it. There's still a lot of stigma attached. So we're finding that there's a lot of work that our substance use coordinators are needing to do with the partnership and with families to really dispel some of that stigma and really get people talking and making sure that we're offering the right amount of support.
Brilliant. And Alison, did you want to come in as well on this?
Yeah, just kind of building really on Lindsay's comment about the many eyes on one issue. So I don't know if you know, in Doncaster we had the floods, and then that was quickly followed by the COVID pandemic, and it kind of left us in a situation where we really needed just all hands on deck to get support to our families as fast as we possibly could. And we came up with what we now know as our local solutions groups, and they've really been very, very instrumental in that kind of everybody in a room together, how can we all help? An example I can think of off the top of my head was a lady had kind of given birth in the middle of all the chaos, and she didn't have a cot and she didn't have bedding, and it was actually, rather than it being let's fill in a paperwork referral which gets emailed somewhere, which then has to wait for somebody to then review that and then decide which is the best service, it was literally all of our kind of statutory services, but also our voluntary community and faith sectors, all kind of in what we were calling kind of response hubs, where they all just kind of came together and said, oh, I can do that, I'll get a food parcel, I'll get a cot, I've got some blankets, I've got a bit of money, I can put heating on for the family, all of those different things. And what it's really enabled us to do then is to kind of establish those really strong relationships working forwards. And we do have kind of quite a good blended mix of where there's a commissioning arrangement in place, but where it's actually less about, well, you're that service and we're this service, and more just about actually, in our local localities, in our communities, what's the gift that we've got in our places, in our areas, what strengths have we got, and how do we all just come together to make that kind of biggest impact as fast as we can for those families.
Thank you both. We've also got a question come in about the outreach and digital offer. And it might be that local authorities and the evaluators want to touch on this, because the question is, how have you evaluated the outreach and digital offer? And there's lots of feedback on the importance of the physical hub, but for how many families will outreach and digital actually be the main way that they engage? Lisa, can I come to you on this one, and then maybe Sarah as well?
Yeah, of course. So yeah, absolutely. I think family hubs have kind of historically come from a model of requiring a physical space for people to come into, and there certainly is a place for that, I think, within localities, people knowing where to go. But certainly for us in Essex, we've also got a community engagement model as well that looks at asset-based approach of what's existing within the community. How can we outreach to there? Because certainly some areas for us within Essex are very rural and very limited to access if you're only working to a district model of family hubs, which we are. But in addition to that, as was mentioned earlier, just because us as family hubs and local authorities who have presented today may be a bit further on within our journey, it doesn't mean that we're not always considering our next steps in transformation. So within Essex, we're just about to mobilise our digital platform that will act as a digital family hub that engages with families, so that families will have an access point of 3 ways to be able to access their family hub: through a physical way, a telephone or community-based approach, and also the virtual offer. And there's lots around it, certainly in terms of the transformation money that's around. There's a real focus within that local authorities or providers are considering their digital platform and how they're engaging with families in that way. There's lots of different ways of solutions of that, but it's equally about ensuring that whatever you're having as your digital platform still creates that model and intervention of an integrated model, so that you've got kind of ICBs, lots of other areas that are already looking at digital platforms, and it's how does the family hub have a place within those existing self-prescribing, social prescribing platforms that can bring it together, rather than again recreating or duplicating the wheel.
Yeah, I just wanted to reflect that when we conducted the fieldwork for the interim evaluation, it was at the point that some services, particularly health services, were still under restrictions for the COVID-19 pandemic. So there were limitations on the degree to which families could actually come in to the physical family hub buildings to access services. And one of the things that we picked up in our conversations with staff in Doncaster, but also with parents, was about the degree to which they had pivoted to using digital platforms for engagement, and particularly around the use of social media for engagement. And what came across initially was that there were some real positives associated with that. So it had enabled the family hubs teams to develop relationships and maintain relationships with families and with parents, and there were some real strengths with that. But actually, as time went on and those limitations eased a little bit, what we also picked up was that actually families really valued the opportunity to come into the family hub spaces. And that was particularly important in terms of building peer support and engagements and connections within the community. And I think just picking up on the last speaker's points, one of the things that also happens in Doncaster is where there are geographically remote communities, there's also emphasis on utilising kind of community spaces and engaging in community spaces as well. So that outreach model. So I think the key takeaway that I would take from this is that actually a menu of options is important, and for most local authorities, the combination of physical space, a digital platform, and outreach is going to be a kind of effective way to engage families into family hubs.
Brilliant, thank you. I think we've still got time for a few more questions. There's some questions coming in about data sharing. Will there be consent gained for services under the Family Hub model to share information? And or will be sort of information held centrally? Majella, did you want to come in on that?
Yeah, I'll just do a sort of very simple answer from our point of view. So within our early help module system, which families who would gain any access to any of our family help activities, interventions, programs, whether they be on a plan or not, would go on our early help system. And at the very, very beginning, when they're engaging with an activity, be it with any worker, they're asked for their consent to share their information. So that's recorded and they can be selective in who they want that information shared with. Quite often it starts with very, very minimal. And then as you gain, and again, going back to the relationships, you gain the trust of that family. And I think it's being open and transparent and revisiting with each family the benefits to be gained from sharing their information with another department, another service, another agency, be it CVS agency, be it a health agency. So I think it's about always revisiting it with the family to get there, to gain their consent. So that's where we are in Sefton.
Thank you, brilliant. Did anyone else have anything they want to pick up on that? If not, we can squeeze another question in. There is a question, or a couple of questions coming in on the voice of children and young people being included and how the voice of the child has been captured. And this is sort of in terms of sort of the research as well. I think, Alison, did you want to come in on this first?
Yeah, I think really just backing up a lot of the key messages that all of us across all the different local authorities have already said today about it's just so important not to just see the family hubs as something that's standalone, and about embedding those processes across everything that you do. And in Doncaster, we've got our kind of own version of a child-friendly model, and what we're kind of our expectation across all services that work with children to ensure that that child's voice is embedded into everything that we do. And as part of that, we've got a youth council. We've also got employed young advisors. We have a system that's called Primary Voice, which goes across our primary schools. And then obviously across our family hubs, that's more around observational level of child's voice with those really, really small children. So what are they telling us within their kind of actions, their behaviours? And then also what do we learn from those families when they're accessing sessions in terms of whether it's interesting for them, grabbing their kind of meeting their needs, all of those sorts of things. So I think that our young advisors, what they do for us to be able to say that we're child friendly is they come and do a full participation audit across all of our services, and then we have to kind of provide them with an evidence base around how we gather that voice and how we're ensuring that we are embedding their opinions, their feelings, their views into our service delivery and ensuring that that affects change. And that really helps us to just keep our eye on the ball all the time and just ensure that we are always being mindful of making sure that that voice is a thread through everything that we do.
Fantastic. And did anyone want to come in terms of the research and evaluation on that?
Just very broadly, briefly, not from the current study, but just in terms of that participation of children and young people. So there are a range of techniques which we've deployed, and had the focus of the study been right for this one, we'd have done the same. A range of sort of participatory ways. So in the past, for example, we've used persona dolls as a way of engaging directly with young children, working with older children in a way where we engage with them in smaller groups with participatory methods where we might be presenting them with asking them to perhaps use their own methods of data collecting through the use of the phone as a data collection tool, and then working within that diary forms. So there are ways that we can do that. Could be used by local authorities. I guess the major downside of some of these is they are quite intensive and quite difficult and need sort of space to think through, but they can be very worthwhile if you've got a very specific issue you want to pick up, but not something which is something that you can kind of do as sort of day-to-day data gathering, I think.
Brilliant, thanks, Mike. So we've now come to 11:30. I just want to say a huge big thank you to all of our speakers for a really interesting session this morning. And thanks also to our audience as well for taking the time to join us today and for sharing lots of your questions. Just to confirm, we will be sharing the slides from today. And I also wanted to say before we go, a thank you to our amazing training team working hard behind the scenes, and also to my colleagues Huma, Erica and Laura for your help backstage as well. And we're going to link to the evaluation reports so that you can look into them further. And also we have a summary available on our website. At the end of the webinar, you will be redirected to a survey form. Please do fill this out. We really would appreciate it. And all of the feedback will be used to shape our upcoming webinars. And just a reminder, you can book onto our future upcoming learning events on our website, and do sign up to our Family Hubs in Mind Learning Network to receive our newsletter. Thank you all so much, and hopefully see you again soon.